Clergyman and academic Douglas Horton said, "Smile, it's free therapy." The problem is when some people smile, many times they don't like what they see, crooked or miscolored teeth. Joining us with a range of convenient ways to enhance your smile is the Texas Tooth Lady, Dr. Terri Alani. Good morning.
Good morning, Deborah.
All right. You do all general dentistry, but your specialty is cosmetics. What made you decide to go into that?
I like to make people look good.
Oh, well, there you go.
Everybody wants to
Yeah.
look good.
Yeah.
And you know what? It's a great feeling to enhance someone's appearance.
Yeah, you know what? I'm
Give them
going to go on a
confidence.
side note here that I think is so cool about dentistry as well. You're the first one that made this, a lot of people are aware of this. When people come in, it is the gateway to all kinds of things. You've actually discovered when someone had diabetes, when somebody had high blood pressure. And so getting your teeth checked is kind of like a wellness check too.
Well, the mouth is a gateway to the rest of the body.
Right.
Absolutely. But with cosmetic dentistry, we actually give our patients their confidence back.
Yeah.
And that's why I love my job.
Yeah. All right. Let's start with what we're looking at right here. Okay. So like even straightening teeth does a lot, right?
So basically, my whole perspective and focus in my office is on aesthetic dentistry. I'm a general dentist.
Right.
But patients come in and they want veneers. Not always are veneers the best option. Sometimes you have to correct their bite and the way the teeth are positioned, because if not, it will reduce the longevity of the veneer. The veneer can fracture if it's not put in the right position. So many times patients come in and we have to do a combination of Invisalign and veneers. Okay. So Invisalign, they're just clear aligners that are placed in the patient's mouth, and they change them every 2 weeks, and they can go from either Invisalign Express to full Invisalign. So they're
what's
different.
The Express?
Invisalign Express is just 10 trays.
Oh.
So if you need minor teeth movement, and a lot of times we'll just do minor teeth movement to get the teeth in a better position so your veneers will last.
Okay. All right. And then, of course, there's like implant, single tooth. All kinds of things can happen where you need a tooth. There's always one that doesn't want to participate or just leaves you, right?
Yes. So the most difficult thing in dentistry is to fix that one front tooth. It is incredibly difficult because you have to not only recreate the shape, but you have to get the right color. We do a great job. It's a combination of an experienced cosmetic dentist and a great cosmetic lab. So this patient right here had broken her front tooth. We ended up crowning it, and you really can't tell the difference.
Not at all.
Yeah, so I call it invisible dentistry.
Yeah.
And that's one of the most favorite things I like to do because it's very challenging.
Yeah. All right, veneers. You touched on veneers earlier, but veneers can come in different forms. A lot of times people might think, oh, you got to file down the tooth and you got to do, you don't always have to do that.
Right now, the trend is toward minimally invasive dentistry. Nobody wants to have exaggerated prepping or anything like that. So these are veneers, and veneers are basically thin facings that are applied to the front of the tooth.
Yeah, as the name veneer would apply.
Yes, so we do a lot of minimal prepping now.
Oh, look at that.
This is an actual patient. We've gotten our photography down in our office, so you can clearly see there's no way that whitening is going to give you that result.
Yeah.
Plus, they become more symmetrical. Again, we did 8 veneers on this one particular patient, and it just enhances your smile and just gives you that wow factor. On this patient, we did 8 veneers as well. Now, you can do just 2, 4, 8. We usually don't do 6 because the eye teeth are really prominent, so you want to include
Do what you see when you smile.
Yes, when you smile. And again, you can tell this patient had some chipped yellower teeth. It just enhances the smile.
Yeah.
Beautiful.
Really pretty. All right.
And you also, let me just say one other thing. You also can do just lower veneers. So for this particular patient, you can definitely see, I mean,
basically you address the problem children.
Yes, you address the problem children. And there are many children to be addressed most of the time.
in a mouthful of teeth.
Yeah.
All right. Sometimes people have a gummy smile or they'll have a smile where the gums make their teeth look much shorter or much longer, whatever. You can address that.
Yes, and that's really common, which is amazing. So people will come in and they go, oh, my teeth are too short. No, they're not too short. In this particular patient, we actually used a laser. It took us 20 minutes. There's no pain, there's no drilling, there's no bleeding, and we simply melt away the gum tissue at the top of the tooth and take a look at the difference.
Yeah, you can see, well, it makes it look like it's longer.
Yeah,
it
that's
was longer,
done
it was
in
just
one
hidden.
appointment. So that is also can be done in conjunction with your veneers, with your crowns. It's a lot of multidisciplinary procedures that are done in our office.
Yeah, composite bonding can give you a whole different impact as well.
So we close a lot of gaps. Some people do not like their gaps closed, but if they choose to, then we can close gaps. And this is a simple reversible bonding procedure that basically took me 1 hour.
Oh, wow.
And again, you can see this patient came in with some gaps on the side. No, we don't bond the whole tooth. We basically just bond, put material in between the teeth.
To fill those gaps.
Or if you have a broken tooth, this patient was a little bit young, so we didn't want to crown it, and we basically used bonding just to fix that fracture. And in this particular patient, we used bonding for cosmetic reasons versus veneers because it's more of an affordable option.
Okay. Yeah, you mentioned composite bonding. Okay, there's another thing called Snap-on Smile.
My favorite.
Yeah. Right. Well, you know what I love about this is that we've talked to a number of your patients who have used Snap-on Smile, and really, it's Snap-on Confidence too. It's
It
done
is.
so much
So
for them.
basically, it's an appliance. Now, let me just say something about this one patient. It fits over your teeth, and it's removable. There's no adhesives.
You can eat with
There's
it?
no drilling, and you can eat and drink. It's not an internet appliance. But with this particular patient, I want to address the fact that they had had their teeth cleaned, that they had had their extractions done. There is no decay present. Even though the teeth are broken, they were healthy. So you have to make sure that everything is done before the appliance is placed
And with
in your
any
mouth.
one of these procedures, you want to make sure you have the best teeth
Yes.
possible,
Yes.
right? But look at the difference it makes.
Oh, this is a huge cosmetic case, before and after. And so there are many patients that may not be able to afford veneers. They might not be able to afford what traditional cosmetic dentistry has. So this is exactly how it works. It's generally just literally placed in your mouth. It snaps in, and you can take it out when you're not using it.
Yeah, you literally have people who were afraid to even go in for job interviews who just wouldn't go because they felt so bad about their smile. And with this Snap-on Smile, they aced it.
It's given people the affordability to have a beautiful smile versus your traditional veneers. So we offer both as well.
Yeah, Dr. Alani, thank you.